about gout. There's pseudo-gout and then there's gout. Patients will present with acute onset of pain that is the worst pain they will describe to you. Just touching the area where the gout is present is extremely painful. If you have gout on your lower extremity, even just the bed sheet on the lower extremity will be painful. They'll present with pain, swelling, and redness. There's two types of gout. There is gout, which is uric acid crystals, and there's pseudo-gout, which is calcium pyrophosphate crystals. They do the same thing, they just look different under a microscope, and we actually treat them similarly. When a patient presents with gout, the differential would be, is this an infection or is this gout? And sometimes we get confused. If I'm pretty sure it's gout, I'm gonna go ahead and start them on either a Medrol dose pack or something called colchicine, which works very quickly to get rid of either pseudo-gout or gout. The only way to diagnose gout or pseudo-gout is to put a needle in the area and draw out some fluid. Uric acid levels might be elevated with gout or it may not be elevated, peripheral uric acid levels. What causes gout, we don't really know. We think that gout might be related to certain foods such as liver, anchovies. I don't know who would want to eat them, but some people do, and there's some association with gout. Also associated with red wine or red meat. I've even read that sometimes seafood or shellfish can cause the onset of gout. Pseudo-gout can be associated with thyroid or kidney disease, but really we don't know for sure. I have patients who are vegan who come in with gout who have never had any of those type of foods. So we don't really know. The important thing is to treat it right away. I usually will see the patient back in the office in 2 to 3 days to make sure they have a quick turnaround, because I want to make sure I'm not missing an infection. If they don't quickly start getting better on the medication, I may reassess and think this is more of a cellulitis. I'm going to